Welcome to Planet Surgery, a medical podcast by BAXTER Advanced Surgery Team.
Hello everyone and welcome to the Planet Surgery podcast series, insights into the world of surgeons, surgery and preparative practitioners across Europe. My name is Marta Almarcha and I'm the MSL for BAXTER Advanced Surgery in Spain and Portugal. Today I will have the pleasure of interviewing Dr. Juan Carlos Durán. At BAXTER, our vision is to be a global, innovative leader in the operating room, providing solutions that improve patient outcomes and enhance lives. BAXTER's podcast program is in a way for you to hear from colleagues across the world. In this episode, I will interview Dr. Juan Carlos Durán, cardiovascular surgeon of the vascular department at Insular University Hospital, located in Las Palmas de Gran Canaria, Spain. He is a specialist in angiology and vascular surgery. Today we're gonna discuss thoracic and abdominal aneurysm repair. Welcome, Dr. Durán, and thanks for giving us the opportunity to have this interview with you.
Thank you very much for giving me the opportunity to talk about this exciting topic that is the treatment of thoracoabdominal aneurysm, a real challenge for the cardiovascular surgeon. For surgeons of my generation who have had the privilege of witnessing the permanent evolution of vascular surgery, we can affirm firsthand that the challenge has been spectacular. In the past, all thoracoabdominal aneurysm in the therapeutic range were operated on with open surgery, which involved a huge number of complications and high morbidity and mortality. At present, we have numerous technical resources and a great variety of endoprostheses that allowed us to face the same pathology with less invasive procedures and with excellent results in most cases. And although we still have to solve a few cases with open surgery, we believe that with the constant evolution of innovation, research and industry, we will be able to solve all aortic pathology through endovascular access in the short to medium term.
What is the new procedure for thoracic and abdominal aneurysm repair you have carried out in your hospital service?
Basically, it is not a new procedure since it can be performed with other existing endoprostheses in the market. The novelty is that we have done it for the first time in Europe with Hercules and Minos, two products of the Microport company. And we are truly satisfied not only with the result, but with the excellent technical performance that this device offers us. Easy handling and very simple endoprosthesis release system. In fact, we are very much looking forward for starting with the castor implant, a variant of the Hercules offered by Microport, that includes a branch to revascularize the left subclavian artery. This allows a better proximal seal, especially in those aneurysms that arise very close to the birth of the left subclavian artery, and in the type B dissection of Stanford classification. The use of this type of device allows greater stability in the proximal anchorage of the thoracic endoprosthesis, less possibility of endoleaks, and, above all, preserve the normal perfusion of the left arm.
What does this surgery consist of?
It basically consists of the percutaneous approach of both femoral arteries in our operating room, which is equipped with the sophisticated X-ray equipment, which allowed us, with the use of contrast substance or carbon dioxide, to obtain images of great clarity to be able to accurately specify the optimal site for stent delivery. in this case the hercules for the thoracic aorta and the minos for the abdominal aorta.
And could you share with us a surgical case using this novel technique?
This is a 68 years old male patient with a history of arterial hypertension and the medical treatment with a saccular aneurysm of the thoracic aorta located in its lower half and another saccular aneurysm of the infrarenal aorta. Preoperatively, a meticulous measurement of the aortic diameters and the exact site of release of both endoprocesses was performed and to choose the appropriate caliber for both endoprostheses. Under epidural anesthesia and percutaneously through both femoral arteries, intraoperative angiography was performed to determine the appropriate release site. First, the hercules was implanted in the thoracic position, and then the same was done with the minos in the infrarenal aorta. The final angiographic control showed the absence of endoleaks, hemostasis of the puncture sites, and hospital discharge in 48 hours. The remote follow-up with angiotomography shows the correct positioning of both endoprostheses and the absence of endoleaks.
What are the benefits of using this technique?
Being able to treat two aneurysms separately shortens the time of the intervention, uses less contrast substance, and in general present fewer complications than in more complex procedures such as those that have to be used when the aneurysm compromises the birth of the visceral trunks. Thus, the patient hospital stay is shortened and he soon returned to his normal life.
Very interesting. What pathologies do you think can benefit from this type of approach?
This type of surgery is indicated in patients with aneurysm of the thoracic aorta and abdominal aorta in the same patient, as long as they do not involve the birth of the visceral trunks, renal arteries, celiac trunk, and inferior mesenteric artery, so that we have enough space to anchor both stents, both proximally and distally to the thoracic aneurysm and the abdominal aortic aneurysm.
And what do you think is the future of this type of surgery?
I work in a highly complex university hospital in Las Palmas de Gran Canaria, and despite the geographic distance, we carry out complex procedures that involve robotic surgery in addition to being the reference hospital in our province for kidney transplantation and stroke code. And of course, our service is up to the demands. The service has a head of department and 5 full-time specialists who are in charge of providing healthcare coverage to the stable population of the south area of Gran Canaria, being the center of reference in vascular surgery for the child population of the entire province of Las Palmas. And in next year, we will officially start our residency program, emphasizing our commitment to the training of specialized doctors in angiology and vascular surgery. And now, answering your question, the permanent updating of vascular surgeons, continuous training and research, and the invaluable collaboration of the industry offer us a promising future in the use of this type of surgery, which provides better results every day and better quality of life in our patients. Thank you very much for the invitation.
Thanks a lot. That was a very interesting conversation. And to the audience, please contact us for any feedback or question. And if you want to be our next speaker, by clicking on the Contact Us button on this webpage, you can apply for becoming a speaker. Thank you very much for listening, and don't forget to come back in 2 weeks to listen to our next episode.